Thank you, Simran. So today with Menstrual Hygiene Day, we are yet another we have joined together for yet another session. And today I'm very glad to say that it's an all-female panel, and I'm very happy to see that. So we are going to talk about menstrual health as an essential but yet overlooked aspect of public health, particularly during emergencies, and how it affects the population with who are vulnerable, and we're going to reflect on how inclusive, empathetic, and responsive planning can ensure dignity and care for all menstruators, not very specific to a gender, especially in disaster-affected and marginalized communities. And today, for the session, we have our first speaker, Dr. Midhila ma'am.
Hello,
Dr.
Kripa.
Midhila.
Yeah,
Hi,
I'm
ma'am.
audible.
Yes.
Yeah.
You are audible, but please give me a couple of minutes for me to introduce you. It is an honor to introduce Dr. Midhila ma'am. She's a social science researcher who primarily focuses on areas of gender, grassroots governance, democracy, public policy, climate justice, and development, with a focus on principles of community leadership and citizen engagement, roles of decentralized democratic institutions, and the life realities of spatially marginalized and natural resource dependent communities at the fringes. She has researched marginalized women, state policies, civil society participation, climate change, leadership, and comparative democratization, with special reference on feminist theories. As an academician, ma'am also positions herself as an inter and multidisciplinary scholar who engages in discourses to define transdisciplinary scholarship aimed at creating holistic, decentralized, democratic approaches to community welfare. She is currently serving as the State Project Officer at the Kerala State Disaster Management Authority. She brings a rich background in community engagement, disaster preparedness, and inclusive governance, which is reflected in her work in the Wayanad landslide also, and how she worked with different genders also. And she has worked in community engagement, disaster preparedness, and inclusive governance. Previously worked as a guest lecturer at the Kerala Institute of Local Administration. She taught subjects related to decentralization, local governance, and public policy. Ma'am has also worked in projects like marching labs. She has worked in UNESCO and Amrita Vishwa Vidya Peetam. I am very happy to have you here, ma'am. I hope you are
Yeah.
able to share your screen, otherwise I can
Yeah.
do that.
Let me try. Okay. Yeah. Is it visible, Kripa?
Yes, ma'am, I can see that.
Okay. Uh-huh.
Please go
So,
ahead.
okay. So thank you, Kripa, for that wonderful explanation and like description. And also, I really thank Spear India for this opportunity. So, as we all know that the concept of menstrual health itself is revolve around various discourses, particularly focusing on the various intersections and verticals. So, whenever we are in an arena to discuss about menstrual health or menstrual hygiene, there are so many things we have to address to. But since I hail from Kerala State Disaster Management Authority, and which for the couple of years which I've been practicing, so my presentation will be highly focusing on the state perspectives. What are the innovative ideas we brought into this particular realm, and also some of the best practices we could trace out. So there are so many things which we involved with, but among them, what were the major significant areas that I will be discussing, so that we can replicate more models like this in other places also. So as you can see, 2018 was one of the catastrophic flood or disaster Kerala community phase. From that time onwards, we really thought about okay, having an inclusive, more resilient community among ourselves. So these were some of the pictures we collected during the 2018 flood. So as you can see that now our camp means our shelters and everything is like well occupied, and there are spaces and everything. But in the initial time during the 2018 flood, this was the situation of the camp. As you can see, most of the cases there are toilet facilities, but the concept of privacy, everything was little deprived for the community. And especially we also had cases from the camps in the initial time, that means the 2018 flood, because everyone has to evacuate immediately. During that time, they were not prepared with anything. So women who were bleeding during that time had to sit in the corner, and only after identifying, okay, they are not having the provision to take care of themselves, then the panchayat and the local self-government and other non-voluntary involved in NGOs and CBOs intervene, and they started. So actually, it's from that time onwards, whatever emergency kit or relief materials which being distributed from Kerala State Disaster Management Authority, we always assured that there are sanitary pads in place. So actually, this particular situation led to some other things. For instance, it was one of the quote from a newspaper article. So it states sometimes it takes a natural disaster to reveal a social disaster. Because when we witnessed what were the things happening in the camp, especially I'm talking about in the response phase, that means not about the relief or the rehabilitation. During the response phase, how we have to prioritize menstrual health or menstrual hygiene, I will be largely focusing on that. So during that time in the camp and other situation, a kind of social disaster was also brought out. That means the concept of period poverty, or like a female or the group, we called it as like menstruating group or menstruating gender, what are the problems they've been facing. So most of the time, for even for us, it they needed to have a natural disaster to open our eyes in order to see, okay, there is a social disaster also happening around. So Kerala State Disaster Management Authority, even though we are following the NDMA guidelines, the Sendai framework, but most of all the time we always try to focus on the SDG indicators, for instance, like leaving no one behind the agenda, and also towards a safer state. So leaving no one behind, we prioritize inclusive disaster risk reduction policy. So gender is one of the core area which we always try to focus on, and the entire concept of menstrual hygiene and menstrual health came from there. So, as we all know that the SPEAR standards itself have a certain minimum initial procedures or protocols and services. In Kerala State Disaster Management Authority also we have a minimum initial standard booklet, especially during a relief phase. That means during a response phase in a disaster situation, during the response, what are the things a government or the institution has to take care of. So there are many things which we address. That particular minimum initial standard book is also available in the KSDMA website. So these were some of the important things which is connecting to the menstrual hygiene. We all address the reproductive health, and also as we all know that the United Nations Population Fund is having a minimum initial service package. So we made sure to have a sexual reproductive health security. So during that time, in our minimum initial procedure book itself, we have mentioned if there are people in the camp during the response phase, you have to make sure there is initial service package or the service kit is available in the place, and also the health centers needed to be there, and the Kerala Water Authority needed to be there with enough of water, because since we are menstruating during that time, hygiene is a priority. So water, this much amount of water needed to be there in particular camp, and also the junior public health nurse will also be available in the camps. So these are, and as you can see, this is about like in the camp. As a part of the initial service, they needed to have soap. They also needed to have laundry soap, laundry powder, sanitary pads in order to wash their undergarments, and also in the relief kit or in the materials immediately what the Grama Panchayat, because as we all know that in Kerala the relief camps are being managed by the Panchayat, Grama Panchayat president and the working group. So they needed to have in place, if there is any red alert, the people immediately have to evacuate and they had to bring to a relief camp. Then they have to make sure along with the sanitary pad undergarments are also available. And this is another thing, Orange Book. Orange Book is like a standard operation procedure for Kerala State Disaster Management Authority. It's basically an SOP for monsoon, but we have not only addressed monsoon, all the disasters happening in the place. So how to prepare for them? Actually, it's in Malayalam. Every year we are renewing it and updating it. So it's basically this SOP is all about what are the responsibilities, mandatory things a department needed to do prior to a disaster disaster, during a disaster. And Spear India being one of the significant IAG member for Kerala State Disaster Management Authority, there are one particular portion mentioned what are the roles and responsibilities of IAG. So in this book also, I have not quoted the particular wordings from the book, because in every department also needed to have or also needed to give prior importance to gender, at the same time health. So in this booklet also we have extensively wrote about these are the activities you have to do, especially with relation to menstrual health. And also this is the emergency kit. It's one of the IEC materials we have developed. So before a disaster, or like if there is no disaster, also in within your households, you have to have a emergency kit. So in that emergency kit, also we also talked about the importance of sanitary pads, and also when a disaster struck a community in Kerala, if you are supposed to bring assistance, then in the emergency kit, make sure all these things are in place. So in that also menstrual hygiene, menstrual health related, for instance, sanitizer, soap powder, and sanitary pads, everything is involved, included, and goes beyond border. So what we did is like during last 2003 December, Tamil Nadu witnessed a massive flood. So for that we have provide assistance. So in that actually they asked for dry rations because many of the households were affected. So what we made sure is like along with the dry ration, we provided necessary materials which we been distributing in our emergency kit. As you can see, that small packet of Stay Free, that also we incorporated. Whatever we are doing, we are trying to replicate into other places also while giving prior importance or like significance about menstrual health. Another thing is like inclusive DRR. As we all know that most of the cases we have women or like women who are who became trans men, but during the phases of their hormonal therapy and everything, they will be menstruating. But from the look, they will be looking as a male. But during these cases, during that period time of the month, they will be bleeding. So we also try to address the concept of inclusive DRR with respect to transgender. So we always hold on the concept like we stand with all the menstruators of all genders. So it's not only women we are trying to address, all the genders who are bleeding, we are trying to address their issues also. So as part of transgender sensitivity, also we are trying to generate like in the camp management, whenever we are giving training program to police forces or any other panchayat or any other government representatives, we always said we always make sure that it's not only women, there are other genders also who bleed. So you have to give prior importance to them also. Yeah, as part of that, we are coming up with like gender neutral toilets and everything. And another initiative as part of our Kerala State Disaster Management Authorities did is like, as you all know this, in the last, it's going to be 1 year. In last July, we witnessed a massive landslide in Mepadi of Wayanad district. So as you all know, like after every disaster, we will be doing a post-disaster need assessment study. And for Mepadi landslide, also we did a post-disaster need assessment study. And the NDMA guidelines, even the global SPA standard also always focuses on the loss of tangible assets. Okay, how many damage and loss for infrastructure, how many damage and loss for the buildings, we will be highly focusing on that. But no one really addresses the concept of intangible, because there are so many things which are not seen by our eyes, which only can be felt. So this is a framework which we developed based on that, because the community was like culturally and socially very rich, so their emotional trauma was very much. And also that particular area of Wayanad was a tourism hub, so the environmental loss was also there. So this is the framework which we developed, and in that one particular aspect we addressed is loss of fertility. So don't mistake, like even though we talk about fertility, we use the word fertility, but that doesn't always connote or connect with the concept of reproduction. We just opened it on the concept of reproductive health. So in the loss of fertility, we address like there are people like especially we focused on SRS, sexual reproductive health. So these are the things which we addressed because during that time, because of the cycles or the hormonal change and everything, they can also be gone into certain shocks, which can lead them to certain kind of stresses, emotionally and mental strain. So this is another thing. So whatever project and initiative we've been trying to do, we always try to collaborate the concept of gender, at the same time all the aspects of gender, physical health, mental health, and physiological health and biological health also. So as part of this, in Wayanad landslide, we started a geo coordination as part of that Family Planning Association of India. They came in, so they actually is certified to have, in order to execute, or like they are certified to use this minimum initial service package. That means all the sexual reproductive health assistive things. So along with them, our sexual reproductive health department, as part of DMO, district medical officers, and KSDMA, we signed a project, and as part of that, we did a camp with respect to menstrual, not menstrual health, with respect to sexual reproductive health. So this is another intervention we did. So what exactly we are focusing on in like bleed with dignity. Even actually we all know that disaster hits everyone differently, and there are certain population who are not in the mainstream, or like in the mainstream they are not in the mainstream society, certain concepts or certain aspects are not really accepted, but we have to embrace who we are. With dignity we have to live. So this is the particular concept we are focusing on, bleed with dignity. Even if it's a camp, even if it's a shelter home also, you will be having all the necessary things in place to have a dignified menstruation. So we always think like menstruation, it's a part of human rights. And also another thing is like menstrual hygiene is a necessity, because some of them in the camps, we had many anecdotes and we had many case studies from the camp, like men blaming them. Okay, this time it's like if you are a dialysis patient or a cancer patient, you needed to have medicine for that. This is a common thing, just adjust with the cloth or something. They always used to get blamed for this. So what we always try to do is like we in most all the camps and whatever the activities which we been doing with respect to gender, we always try to highlight the concept like menstrual hygiene is a necessity. Another thing is like end period poverty. As of now, we are distributing pads, because as we all know this, we have different type of people, people with PCOD, people with fibroid, people with heavy menstrual flow, and also people, especially gender menstruating people with intellectual disability. So most of the time they won't be able to use the menstrual cup, but we are trying to incorporate the concept of menstrual cup also into this our relief kit material. So those who want to use, because the usage of menstrual pad leading into pollution, environmental feminism, everything is another discourse. That's why in the initial time I mentioned like there are so many discourses which we won't be that much dwelling into, but we are really looking forward to, is there any sustainable use of menstrual product this women can buy. Another thing is also like it's a bit costly also, so we have to identify stakeholders. So that's we are working out. So actually the concept we really wanted to put forth is like everyone had to think about is like in the panel opening, Krupa just mentioned like we have all the female members to talk about. So one of our aim or like objective which we are thinking is like maybe in the next menstrual day there can be one more male member to discuss about this. So this kind of taboos and other things related to menstruation has to be changed, because in Kerala we have different populations also. One particular population is a scheduled tribe population called Muduan. So they have the custom of, even in Maharashtra also we have this, they have this particular house. When you are menstruating, you are supposed to sit there. After menstruation only you are allowed to come to the household. So during that time, and the many of the tribal population, especially Muduan, are residing like they are staying inside reserve forest. So there can be a chance of like human animal conflict, maybe a wild animal attack. So it's really not safe. So there are so many cultural and other taboos around the concept of menstruation. So we have to challenge, and we have to not challenge in order in the sense like that's a social cultural practice of a community that we can't really change it, but learn with them, try to understand the community, what exactly the need is, then we have to address it. Then another thing is like we have to highlight the urgency of menstrual health. Another thing is like we have to push the policy makers further to have more inclusive approaches. In KSDMA, what we always do is like, even though we are a government institution, we always try to collaborate with educators, communities, policy makers, NGOs, and CBOs, so that we have lots of NGOs, organization exclusively working for menstrual hygiene, exclusively working for trans communities. So whenever there is a project or something which we have to come up with, we always try to go and seek their help. So from that learning process, we can have so much good initiatives. Another thing is like platform like this needed to be more like more male and more other gender people needed to have in the discourse. So more communication needed to be there, and never be not be like unapologetic. It has to be there. And as the CS theme, together for a period friendly world, together only we have to address like people will be experienced. Sometimes we used to hear, until and unless we walk in some other shoes, we won't be able to feel it. So other gender maybe used to say that, okay, we don't experience menstruation, so we really don't know that. But it's not like that. We have to, because so many sensitized open discussions are happening nowadays. So together is a crucial theme. So no one fights alone, everything for everyone. There is a collective consciousness. So that kind of things has to be in place. So in case that's what we are basically focusing on. Not only a single person, everyone has to come together in order to address this kind of issues, which can be a social disaster in the coming future. So Krupa, that's from my side. Thank you.
Thank you so much, ma'am. Thank you for your very nice inaugural presentation. Thanks for also mentioning the importance of the pre-positioning of relief materials, including the menstrual hygiene products, and about how Kerala's initiative on the gender-neutral toilets and inclusiveness of all genders, and how you talked about the intangible assets impacts in disasters, and what more can we ask for in the inaugural presentation? And when I talked about all-female panel, it was more about how we can see women in leadership roles who give very nice insights like you did. But we will try to have more male voices to be included in the next session, which we have on sexual and reproductive health or menstrual hygiene. Thank you, ma'am. And now that we have our moderator, it is an honor to introduce her before we go to the next speaker. And she will take it from there. Miss Satya is my junior, and I'm very proud to introduce her. She's a committed psychiatric social worker and doctoral scholar at the Madras School of Social Work, with a strong focus on women's health, community mental health, and adolescent well-being with a background of allied science. She combines clinical experience with social research and grassroots engagement. She has worked with leading institutions like Apollo Hospital, ICMR NIE, Adair Cancer Institute, and Enhance. She one of her core focus areas menstrual health and hygiene, where she did also start her own NGO, and she's the CEO and the president of it, called Penmai, and she's also the CEO and president of another NGO called Giggles. She has led and implemented projects like Duram, where she worked with adolescent girls in government schools and community women in Chennai. She has also facilitated awareness sessions for parents and youth, promoting health literacy and psychosocial well-being. She has authored one book and she's currently working on another. And she has around 15 research paper publications where she works with topics like AI in health and social work, adolescent substance abuse, and women's health. Her academic excellence and leadership in community service have earned her several recognitions, including awards like the Best Outgoing Student Award and the Youth for Social Development Award. Over to you, Satya. I'm very proud to have you here. Please take the moderation forward.
As said, thank you, senior. I take this privilege being your junior as well. Sorry for my delay. As ma'am, Midhila ma'am rightly mentioned, thank you for her valuable insights where the policy level evidences that she provided at the community level will eventually change will drive the change as well. So moving on, I wanted to first congratulate Ms. Jennifer for the documentary release, ma'am. To introduce our next speaker, Ms. Jennifer is a pivotal figure in India's public health landscape with over 15 years of leadership in water, sanitation and hygiene and menstrual hygiene management. As a senior national MHM consultant at UNICEF India, she is at the forefront of national efforts to strengthen menstrual health policy, education and service delivery. She is currently leading the national rollout of a comprehensive MHM module and handbook and contributing to India's upcoming national MHM policy under the Ministry of Health and Family Welfare. Her contributions have extended to enhancing sanitary product safety and sustainability through her role with the Bureau of Indian Standards, as well as developing state level MHM roadmaps and action plans that have improved access to menstrual hygiene for unreserved communities. She has authored key IEC materials used by governments and directly trained over 5,000 professionals, community leaders, and healthcare workers, making her instrumental in building grassroots capacity and awareness. Jennifer's earlier work at globally respected organizations like WASH United, the World Bank, ICRC, Caritas India, and Water Aid India laid the foundation for many transformative public health initiatives. She played a central role in developing India's first MHM guidelines in 2015 and initiating menstrual hygiene day activities nationwide. Known for her innovative use of game-based toolkits and participatory curricula, she continues to champion inclusive, right-based approaches that improve hygiene education, reduce stigma, and advance equity for women and girls across India. So this session is going to be understanding menstrual health and hygiene needs during disaster. So over to the speaker.
I hope I am audible. Thank you, Satya. As Satya mentioned, I am in an event organized by UNICEF and Ministry of Health, and we are launching some IEC materials today. And I am at the venue right now, so I would actually prefer to keep my video off because people are walking here and there, and I can't stop them from doing that, and it's distracting me as well. So also my Wi-Fi connection is not great inside the hotel. So I will talk with my video off and I will try to give examples and talk through stories and connect it with um, what are the challenges and how to go ahead with those. If I'm not using a PPT, but if anybody wants it at the end, please let me know. I will share a copy of it. Okay. Okay, so I will start with a small incident that happened in one of our areas of work in Assam. I will change the name of the person and the exact location uh, for privacy issues, but there was this flood that hit Assam some time ago, some years ago, and it was the third day after the flood hit a village, and there was a 14-year-old girl called Rupa and her family and she were one of the affected ones. And they had taken shelter in a crowded government relief camp, which was set up in a primary school. She hadn't carried anything except for her school bag and the clothes that she was wearing. No other essentials was taken. On the second day of being in the relief camp, she got her periods. Um, what happened, the scenario, what she described was that the toilets were overflowing. There was no proper place for her to take bath. The camp had no menstrual pads. No one even thought of bringing them, not even the ladies and the girls in the camp. So Rupa had to tear a part of her dupatta and use it as a cloth, though she was already wearing it for last 2 days. She had no place to wash or dry it without people seeing it. So she continued to breathe through the cloth and stained her only salwar. She was so mortified that she stayed in a corner of a classroom um, where their family was sleeping, and she refused to move from that corner for the next 3 days. Her mother asked the volunteers if they had anything for ladies' needs, where she was given a puzzled look and they couldn't understand what she was saying, and the mother couldn't openly ask for a pad, as you know, village people. And then the volunteers were all men, because of which it was never prioritized. So for the next 3 days, Rupa stayed in that corner. She barely ate. She didn't go and fetch her food. Whatever was brought to her by her parent, she had eaten it. Um, she was afraid to move. Her period ended, but she was sick. She had developed a severe rash, and she had to, after the flood got over, she had to take a proper clinical treatment for what she went through. So no one thought about her menstrual health, and to understand the impact of the situation, she was not the only one. She was just one of the stories that really captured our attention because of the ill health that she went through immediately after it and the medical care she received. But there were many others who didn't even um, dare to speak out and express them. So when we talk about this story, what I would like everyone to just think about what went wrong here. Okay. Some of the things that we could say is menstrual needs were not anticipated in the relief planning. No menstrual products, pads, cloth, disposal bags were included in relief kits. Lack of privacy in the shelter made it impossible for Rupa to manage her period. No female-friendly toilets or bathing areas were there because it was a primary school. No female volunteers or staffs were present to understand or support such needs. Rupa had no access to safe disposal or clean water to wash her clothes, wash herself, etc. The emotional and physical toll was completely ignored here. Rupa ended up being isolated, stressed, and also ended up being severely sick. Okay. So, in this context, let's now understand what are the key challenges that menstruators face during disaster. Firstly, lack of access to menstrual products. Relief agencies often prioritize food, shelter, and medicine. Menstrual pads are many a times forgotten, or it comes later on. The immediate relief is never, a menstrual pad is never, usually not included. Um, so that's one. In 2018, in Kerala floods, many girls reported using newspaper, wet cloth, or plastic bags due to the absence of sanitary products, which they later received. But in the initial weeks when the flood actually hit and they went into relief camps, they had to use these things to manage their menstruation. Reusable cloths are suggested, but becomes unusable due to lack of clean water, drying space, private space to clean yourself, etc. Absence of privacy and safe spaces. Emergency shelters are typically school buildings, many a times primary school buildings or halls where there are no separate toilets or changing areas. For example, in cyclone-affected Odisha, adolescent girls reportedly waited until dark to change pads behind the bushes because they felt it too ashamed to use the common washrooms for the same. Risk of harassment also increases in mixed gender settings without adequate lighting, logs, and therefore the importance of privacy and safe spaces increases in this context. The third point I would stress on would be inadequate wash facilities, water sanitation and hygiene facilities. Toilets are often broken, flooded, and are too few. Even if we are given a proper functioning toilet, by the time it's day 2 or day 3, it's usually unusable, it's flooded, and latches are off, broken, taps are leaking, Um, just a moment. Sorry for the interruption. Yeah. So there are no water for washing hands. Reusable cloths are not available. All the cloth that is available to them are the other cloths that are either they are wearing or the ones that they have bought, which are um, maybe unwashed dupattas and kurtas, salwars, etc. Hankies. Um, Then there are no disposal bins or incinerators. Menstruators are forced to usually hide or bury used pads. I think when we talk about menstrual hygiene in emergency setting, we have to understand when we are saying that people are not prioritizing menstrual pads, disposal is the last thing in their mind. So that itself puts a huge stress on the menstruator on how to dispose the used item. Science and shame and cultural taboos around menstruation. So girls may not feel comfortable asking male responders or volunteers for menstrual pads. The cultural beliefs in many communities or in smaller communities in remote places, villages, restrict menstruating women from using shared toilets or kitchens, even in a crisis situation, especially with men or boys, which again puts them in a very uncomfortable situations. Um, Also, these kind of situation leads them to self-isolate and puts them into emotional distress. Finally, the last impact that I would say would be health risk and psychosocial impact this has on menstruators. Using unclean materials can lead to urinary tract infections, rashes, as we saw in the story, and then reproductive tract infections. Constant anxiety about leaking, the bad smell odor, or being seen bleeding can actually prevent girls from eating, sleeping properly, and seeking help, speaking out, asking for any kind of help, you know. So that kind of anxiety puts them at a psychosocial risk. In some camps, girls skip meals and using toilets frequently to reduce bad changes, which causes and leads them to dehydration and weakness and other reproductive infections. So, given this scenario, let's now go back to the story that we that we heard about Rupa, and see how the situation that we talked about could have been prevented. Okay, so we can say there could be three phases. The first is the preparedness phase, that is before the disaster actually hits. Usually, we know which are the flood affected areas, which are flood prone areas, and where we need to actually intensify our efforts in. So, in that phase, inclusion of menstrual products in emergency stockpiles and pre-positioning relief kits are very important. Training for disaster response staffs on gender sensitive wash, including menstrual health. I think this is immensely important, given that majority of the responder staffs are males. So gender sensitive wash is immensely important. Involving women and girls in emergency planning committees is again something that has been continuously ignored for years, and that should be included. Mapping and listing of menstruators living in vulnerable areas during a risk assessment is something, again, that needs to be focused on. In response phase, that is during the relief, dignity kits should be distributed to every adolescent girls, woman, which should include sanitary pads, cloth, menstrual cup, or tampons, whichever they are using, soap, underwear, disposal bags. These are some basic things that needs to be included. Whenever we talk about dignity kits, we also have to understand and dignity kits and the products that we are giving in the kits. We also have to um, uh, kind of understand what is the situation there, which kind of product should be pushed or should be given, whether it's reusable pads, whether it is menstrual cups, the demographic of the race, the cultural taboos, and finally the usability, um, and of course the disposability of the product. Um, then we have to focus on safe spaces and female-only toilets or bathing areas for relief camps, even if it is something that is not a permanent structure, but a movable structure. It is important that we have female-friendly toilets and bathing areas. Deploying female volunteers or health workers who can communicate sensitively with women and girls and help them and guide them is something that is not given even much importance, that needs to be focused on. Providing information and counseling about menstrual hygiene in local language is also something that has to be stressed on. Uh, as you know, if you and I suddenly land in a place in Bihar, and suddenly start talking about menstrual hygiene and ask women to um, talk to us, it doesn't happen. It rarely happens. We need people um, who are among them. um, they should be trained, they should be given, used for giving information, imparting information. Proper counseling should be given. So I have been a part of Caritas India initiatives when there was flood that was hit in Bihar, in Assam, and in Kerala. One of the things that we saw was, as I said, males were the major responders. Hardly one or two females would be sent, and that too in the later phases. Initial phases, it was always the male responders. And menstrual hygiene became a part of it only after I entered and started stressing on it, because I had been working on that field. But even after that, the male responders just used to take a 10-minute session on what is the major um, products available, how to use it, how to, the proper key hygiene messages that we talk about. They hardly used to stress on that for 5 to 10 minutes, which is not enough time. And this used to be done when the products used to be distributed. So if we can imagine the situation when they are getting their relief products, they are made to take the products and given a 2-minute counseling or hand holding on the sanitary pads and what are the key hygiene messages, which is not enough. And as a result, there were lots of women and adolescent girls who reported facing menstrual stress and lot of menstrual health related problems after the entire flood situation got controlled. Um, so from this, we go on to the recovery phase, that is after disaster. So there are two basic things that needs to be stressed on, which is restoration of wash facilities in all the schools and homes with a gender lens, to make sure that the women are totally adhered to. Finally, documentations and learning. I think this is something that is prominent in every field, in WASH, in every sector of WASH that we touch upon. Capturing MHH needs in after action actually helps in improving your response next time. So therefore, these documentations are necessary. Many a times we skip it thinking it's a negative, it might lead to a negative review, but we often forget that it also leads to learning and helps us to amplify our response the next time. Um, so, okay. So to sum it up, there are five points that I would say. We have to have dignity kits in emergency reliefs. Um, some states and NGOs have started distributing kits with sanitary pads, soaps, underwear, clothes, and sometimes even pain relief, which is a debatable subject, but other things have to be included. Like in Assam floods, UNICEF and our partners distributed MHH specific kits to adolescent girls in tea gardens. So that is necessary. And when we talk about dignity kits also, we have to also specify that there has not been any standardization. Many relief agencies don't standardize MHH kits, because of which there is inconsistency. And that is very important, because um, we should have a specific number or item list that needs to be included. So standardization of MHH kits are very important. Then safe and female-friendly wash facilities, as I said. Like in Nepal earthquake camps, women toilets were built there immediately with internal lighting and disposal chutes for menstrual waste, which was a very good emergency response, menstrual response in that situation. And in India, some shelters actually use SHG-led toilet monitoring to ensure safe access for women and girls. If we can kind of work around it and understand if that can be extended towards during the emergency relief situation, that would also be great. Training of first responders and relief workers, as I said earlier. SPHERE standards are there, and they recommend MHM integration and humanitarian training. So those could be used as a basic standards and guidelines to carry out MHH integration. NDMA, the National Disaster Management Authority, also has included gender-sensitive sanitation guidelines, but its implementation on ground is a little questionable. It's many at times often overlooked. Then we have systematic gaps in disaster planning. MHM is rarely budgeted or prioritized in state disaster action plans. No national standards, as I said, for what a MHH-friendly shelter would look like, what a kit would look like, especially a shelter. Post-disaster evaluations rarely include disaggregated data on menstruators' experience, and therefore it makes it hard for agencies to improve their work as years go on. So that is from my side. But on as a closing remark, I would leave with a reflection for everyone for the session. If food, water, and shelter are considered essential in disaster relief, why are not menstruation care considered essential? Is it not? It's not a luxury. It's a basic human need, and yet millions of girls and women continue to suffer in silence during every cyclone, flood, and conflict. It's time menstrual hygiene becomes a core part of our preparedness and not an afterthought, which right now it continues to be. Thank you from my side. If anybody has a question, please, you can ask me.
Thank you so much, Ms. Jennifer. She has left us with an open question to carry forward as well. And this was very neat explanation, neat, crisp for understanding menstrual health and hygiene during disaster needs as well. So thank you, Ms. Jennifer. Moving on to the next speaker. We are also sorry to announce the unfortunate absence of our speaker, Ms. Pradeepa Pandey. So we do have long hours, long time for other speakers to accommodate as well. Moving on to the next session, Voices from the Ground, Realities in Relief Camps. The next speaker would be Ms. Juhi Jain, who is a development professional leading climate resilient WASH and GEDSI verticals at CFAR. She also devotes her time to other portfolios like donor management, communication, and KNL as part of her institutional role. MHH is an issue she is passionate about and would like to learn and take forward. Her previous experience includes leading gender and human rights programs at the FAO, UN, NIAE, Sangat, and Jauri Feminist Resource Center. A political scientist by training, committed feminist, and she has written extensively from a gender and development perspective for over 3 decades. We welcome you to take forward the session, ma'am.
Thank you so much, Prabha. Can you hear me clearly?
You're not audible, ma'am. Can you
hear me clearly? Hello?
Yeah, ma'am, your voice is little low. Can you just
Okay, I'm speaking very loudly. Can you hear me now?
Yes, ma'am.
Okay. Thank you so much. And you know, the speaker before me, Jennifer, has very, very clearly articulated what happens in relief camps. So, this is something which we all are very, very concerned about. But I would first like to start by saying that, today we are observing the Menstrual Hygiene Day, and I would like to celebrate this day with all of you, all of my friends and partners who are here, because it is very important to understand that why we are celebrating this day. This was started in 2014, and we celebrate it because this is an issue which is deeply impacted by gender and social norms, and it must come out of the closet, as Jennifer has very rightly started upon it. Can you still not hear?
It's
Can you
clear,
still
ma'am. You
not
can
hear me?
continue.
Because somebody has sent me a message.
It's clear, ma'am. You can continue, ma'am.
Hello?
Ma'am, you can continue, ma'am. It's
Yeah.
clear, ma'am.
Okay. So, when it started in 2014, everybody was talking about breaking shame, stigma, and guilt. But 10 years later, what the Menstrual Hygiene Alliance, which actually started this day, is talking about is two very, very critical approaches. One is that the mission of the organization is together for a period-friendly world, which means together. The word together is very important because it is all encompassing. It includes everybody, not only women and girls who menstruate, but everybody. And the second is there is a commitment to say that everybody who menstruates is not a woman and all women do not menstruate. This, I want to leave you with this thought while I talk on my other aspects as to why we are looking at these two things. One is because menstrual hygiene is a gender and an equity issue. There are 50% women in the world, and we focus on specific challenges of menstrual hygiene in humanitarian settings in this, but do we also feel that each one of us feels that even normal days can become a disaster if we do not have a single pad with us? So menstruation is a basic gender need. And when I say gender, we are not looking at only women and girls. We are looking at all people who menstruate, which includes people with diverse gender identities like trans men, women and girls with disabilities, tribal women. We are looking at all kinds of intersectionalities of gender when we are talking about menstrual needs of people. Deeply closeted in power and power dynamics, whether it is at the home, whether it is at the community, or whether it is at the system level, this is one gender and social norm which needs to be challenged, questioned, and broken. In many communities, we know it is treated as shameful, it is dirty, beliefs are reinforced. But when it comes to a situation of a disaster or a crisis, it is further perpetuated. And how do we do this? Because how and why do we do this? Because this is a very deeply structural and systemic issue. It is not something which is very superficial, saying that, we in dignity kits, because we have not given a pad, people are facing problems. People are facing problem. People who menstruate face a problem because of the systemic and structural barriers which completely does not recognize the needs of specific gender people. Secondly, when we are in a I'll share some data which we have from, audit of 12 shelter homes in Odisha, which is an extremely cyclone prone and, heavy wind, heavy rainfall prone city. We found there was nothing to do with menstruation. They were not even considered. Toilets were unsafe, shared, open, without water, doors locked. There was no access to sanitary pads or clean cloth, even in relief and dignity kits. There was no disposal system. Forget, if you don't have a pad, who worries about the disposal system? Locations where girls were going, were girls and women and people from diverse genders were going, were increasing the risk of violence and harassment. And because of this, girls and women would often huddle and sit in corners. Many women would not change their pads, even despite bleeding heavily for days, not even hours. And as a result of this, who was getting the most affected? Since these relief camps and shelters usually house people who are either marginalized groups living in urban informal slums, who are poor, elderly, destitute women. There are people with disabilities. There are gender and sexual minorities. And many of them, many a time, for example, the disability group have told us that people with disabilities or people who are transgenders are not allowed in shelter homes. So they are left behind, but this, even if they are allowed, many of the facilities do not cater to them. Now, why does this matter? In my previous speaker said because there is risk of infection, they miss work, girls and women and other genders miss school, they drop out, mental health suffers, gender-based violence increases. But why do we need to focus on this? We focus on this because in relief camps and in disaster situations, it is the gender and social minority group, which includes all the intersectionalities of gender, which are the most severely accessible. We are all talking of climate resilient water, sanitation, and hygiene. How will that come if you're not looking at people who are marginalized, people who are impacted the most? So now, what needs to change? I think we should start by saying that menstruation is not a secondary issue. It is at the center of humanitarian response. And how will we do this? We start from day one of the menstrual response by saying it should be prioritized at every level by developing a collective leadership of all people who menstruate and people who do not menstruate. So there should be leadership at all levels, whether it is at the system level, at the community level, at the household level. So everybody should be involved. It is an issue which should involve everybody. Before planning any relief, talk to people who menstruate. So talk to understand the diverse needs of different people. There might be women who need something, girls might need something, trans men might need different kind of products. We might have people with disability who will need different kinds of products. But we also have elderly women who are experiencing menopause who might need different kinds of products and services along with that. For this, we need to ensure that there is evidence and data gathered from our previous experiences, or even when we are planning relief, as to the kinds of people who will know and who will come to these shelters. And then another important point which I want to make is that let us not only focus on products and let us not only focus on awareness. We should focus on the entire menstrual value chain. So there should be information, there should be counseling and support services, there should be safe toilet with water, sanitation, lights, locks, privacy. There should be access to safe and hygienic absorbents, cloth absorbents, sanitary pads which are compostable, sanitary pads which are not compostable, sanitary pads which are cloth pads, whatever people want to use. So the principle of informed choice is also very critical. And last but not the least, while we are focusing on enhancing access to products, information and services, we should never forget that disposal is a big challenge. In shelter homes and relief homes, if the menstrual waste increases, there are bound to be problems. There will be many more challenges. And finally, what we need to do to address this very critical gap. We should treat MHM as an entry point in disaster and relief planning. It is not the issue, it is an entry point, and the larger issue is access to what? Access to dignified information, access to informed choice of products, and access to safe disposal. So menstruation is only an entry point when we start planning. There are many other integrated issues which must be looked at, and this should be looked by placing those who are affected at the center of this planning. And why? By final reflections on why we think that menstrual hygiene is an issue of equity and it is an entry point, because social and gender norms are at the core of this issue. Gender is often the first barrier which fails, and who knows it better than all of us women who are here. And this impacts our dignity, it impacts caregiving, and it impacts our health. Secondly, menstrual hygiene is not about periods. It is about power, inclusion, and justice. For us as people who menstruate, it is also inclusive. It is also an inclusive entry point for getting gender inclusive wash systems. So you build, if you want to build resilient communities, you want to build equitable solutions, you want to focus on universal access, then you have to ensure that gender is at the center. And when you say gender is at the center, you should ensure that everybody who is affected by menstrual hygiene and its lack should be at the center. And then finally, my last point is, we cannot build any climate resilience or deliver any effective humanitarian aid without challenging gender stereotypes and sensing the needs of people who are affected the most. And this makes it very, very critical that we treat menstrual hygiene as a gender and an equity issue, place people at the center, and when we are doing humanitarian relief, we start with evidence, we build on that evidence, we talk to all kinds of people who menstruate, we plan with them. So governance of menstruation in humanitarian settings with evidence is the key for every kind of inclusive approach that we will take when we are planning humanitarian relief. And this is true for relief camps. It is also true for everyday life, but more importantly, when in relief camps, because that is impacted by climate and the issues which climate brings with it for all people. Thank you. Any questions? I'm happy to answer. There are some good practices like pad banks, which people have opened in communities and ICS centers. In relief camps, there are pad banks. That is one good solution. Inclusive facilities, which my previous speaker also highlighted, is also very critical. But I think moving beyond looking at women and girls to everybody who menstruates and bringing everybody into the tent, into the discussion, will only break the shackles of the long silence and the discrimination and stigma which this issue has. And institutional responsibility is supreme, because once at every level of governance and planning, people and communities who matter are integrated, the issue will also get amplified. Thank you.
Thank you so much, Ms. Juhi. This was actually a session on gender sensitization. Also, the actual voices of ground where she covered 360 degrees, the community coverage was given. Also included inclusivity, which was the need for the hour. She also covered topics like accessibility and the privacy that has to be addressed. So she have already set the tone for the next speaker, which is going to be on inclusive approaches addressing the needs of all menstruators. So for this, I would like to introduce our next speaker, Dr. Abba Ketterpal, who is a pioneering disability rights advocate and the first Indian woman to receive the Henry Viscardi Achievement Award, has led transformative work over 13 years, twice honored by the President of India. She empowers people with disabilities through initiatives in sexuality, education, and mental health. She developed a sexuality toolkit for youth with disability in partnership with feminist approaches to technology. She authored key resources, including the manual on sexual and reproductive health and rights for women with disabilities, keeping you abreast on breast cancer awareness, and going with the flow on menstrual health. Her advocacy toolkit for women with disabilities further amplifies their voices. As a psychotherapist, she supports individuals in self-esteem and relationship challenges. Training sessions for educators and professionals foster inclusive and understanding, while her work on accessibility audits enhances barrier-free environments. Dr. Ketterpal's efforts continue to shape inclusive, right-based approaches both nationally and globally. We are happy to have you, ma'am. You can.
Thank you so much, Satya. Thank you, and good evening to all the panelists and the audiences. I'm happy to be here. Thank you, Fair India. So here I would like to give my presentation. So without wasting any time, I would share it with you. Just a minute. Is my screen visible?
Yes, ma'am, visible.
Okay. So menstruation and talking about it during the disasters and the emergencies, like it is a very needed thing. It was long due. The dialogue on this was long due. Because I myself am a woman with disabilities, and while I was menstruating, and I was scared. What if a disaster struck? And especially in COVID times, COVID was not less than any disaster. So people used to be like face difficult situations. There was breaking in the supply chain, and nothing was available. And after the pandemic was over, I did a report regarding this issue only, ki how women with disabilities and their sexual and reproductive health was affected because of the lockdown and the pandemic. And the and everywhere I found an answer that women with disabilities had tough times during their menstrual cycles. And the most difficult thing that they faced was disposal, even staying in their homes. While they were staying in their homes, it was difficult to dispose of the used sanitary products. So, menstrual health, it matters the most for us, for every woman, and for women with disability and girls with disabilities. It is like a nightmare when there is disaster, when there is an emergency, and it intersects with the public health issue. It is a kind of public health issue, it is a rights issue when we talk about menstrual health, and making it is a critical area for policy, for focusing on policy making, because in India the challenges are great. There is widespread stigma, there is silence around menstruation, and women with disabilities, they bleed in silence. They can't tell it to their family members, to their caregivers. And even if they are going to schools, they are going to colleges, they have to take their days off. So whole lot of stigma is there. There is lack of accessibility of toilets, accessibility of washrooms and wash facilities. So it is important to include everyone, not even women with disabilities, all the menstruators, whether they are trans men or even the adolescent girls, they also face lot of issues. India is a disaster prone country. We all know that we have floods, we have cyclones, earthquakes, and even man made disasters like conflict these days, the chances of wars. So we have vulnerable population with us. Vulnerable population include persons with disabilities, adolescents who do not have much awareness, much training on the issues of menstruation before their menarche. They don't even know about it. And gender diverse people are, they also face lot of ridiculing because unsafe toilets are there, and they are mostly ridiculed. They are stigmatized. If you look at the data on menstrual health, India is a home to 120 million adolescent girls at present. And according to a report from UNICEF in 2021, 71% had no knowledge of menstruation before menarche. Nobody tells them. It is a complete hush hush issue. Nobody wants to talk about it. 26.8 million persons with disabilities, they have inaccessible wash infrastructure. When I say inaccessible wash infrastructure, we do not have accessible toilets. The slope floors are slippery, the doors are very narrow, wheelchairs cannot enter those washrooms. So the infrastructure is completely inaccessible. And 487,000 people in our country identify as transgender, as per the census 2111. And they face stigma and exclusion completely. So, what excludes people? As I have said, there are barriers, there are infrastructural barriers, there are systemic barriers. Social stigma is always present in our society. People don't want to talk about it. Disability and menstruation, they both become stigma issue. And there is cultural silence all around it. Information gaps are also there because the information that is available is mostly in inaccessible formats for many persons with disabilities, like the braille format is missing, sign language is missing. So information gaps are there, and policy shortcomings, that laws that mention inclusion, they are lacking. The monitoring is less, the implementation is less, and we have less budget for all these things. When you talk about inclusive menstrual health and hygiene planning, we need to engage all the menstruators. As my previous speakers have said this, we need to engage everyone. Women with disabilities should be there, trans men should be there, because we say that nothing about us without us. We need to be participants, active participant in policy making, in decision making, in disaster preparedness everywhere. And data mostly remains missing. When we are working in the disaster prone area, or we are the first responders, or we are the rescues, we should know where the people are, where persons with disabilities are. So mapping needs to be there. So we need to have disaggregated data, it systematically gathered and based on disability, gender specific data. We need that. And we need to analyze the barriers that are present. What kind of barriers are there? Whether the barriers are present in the shelters, in the schools, or healthcare services. So we need to analyze the barriers. We need to identify the barriers that we need to remove and integrate MHH into disaster relief, rescue, and relief. So menstrual health management should be a core component of disaster risk reduction plans. Like accessible wash. Accessible wash means accessible infrastructure, wheelchair accessible toilets and bathing areas. Grab bars and non-slip surfaces, because some people who walk with crutches or who use canes or who use sticks to walk, they might slip and it can be hazardous for them. Privacy needs to be there, because again we need to depend on our caregivers, and we need to have privacy for changing and everything. So privacy means dignity for us. Properly lit areas and gender neutral toilets, because like if I am a woman with disability and I need to use that toilet, and if my caregiver is a male, he would be able to come inside the washroom with me. So gender neutral toilets need to be there. And disability sensitive menstrual health management kits, which we call dignity kits. So adaptive products for women with disabilities, we need adaptive products like easy fastening and reusable pads. Because of the lack of hand dexterity and all, we need adaptive products. Instructions in braille, large fonts, audio instructions, sign language availability. So these kits should be there. Disposal bins at accessible heights. When I say disposable bins at accessible heights, means they should be according to the height of the wheelchair, so that they can be disposed of easily. And when we are preparing for the disaster, inclusive education and peer support. So training of the responders should be there. Responders need to learn about disability, what disability is, different kinds of disability, because the relief measure meant for a person with locomotor disability is completely different from the relief measure that needs to be given to a person with autism. So responders need to be trained in disability. Healthcare workers need to be trained in then how to carry them, how to handle them in such situation. Then women with disabilities can become the peer educators here. They can help the communities, then because their needs can be replicated, how their needs are fulfilled, that can be replicated for others. And accessible materials like visual, multilingual, and auditory friendly menstrual health education, resources to ensure comprehension and early integration. We need to embed the menstrual hygiene education into schools and the program starting before menarche. Community engagement means inclusive conversation. At least conversation should start. Local influential influencers should be roped in, and it should be like normalize to talk about periods. People do not want to talk about menstruation and period, and trust building again is very important. When we say policy integration and monitoring, alignment of national laws with the National Disaster Management Plan, WASH guidelines, everything needs to be integrated and incorporate inclusive menstrual hygiene into the DRR policies and frameworks. National and local WASH standards, school disaster preparedness plans, and the partnership with DPOs, disabled persons organization, should be there because they are working at the grassroots level. Ultimately, they reach the people. Inclusive indicators need to be there that develop monitoring metrics for accessible places, accessibility audits that need to be there for persons with disability, transgender, and we need to align the efforts with our UNCRPD, Sendai framework, sustainable goals, and sphere humanitarian standards. So best practices, earlier speakers have talked a lot about it. Best practices we can see they were in Nepal after the earthquake of 2015, Bangladesh refugee camp. It also had disability inclusive menstrual hygiene education programs. Kerala, as Midhila has already said about it. Gunj India does that. It distributes dignity kits in rural and disaster affected areas. And Asha development, they have developed visual monetary guidelines, menstrual guidelines. Likewise, WASH global facilities, they have developed a right-based MHH education tools. UNFPA also has certain toolkit. Uganda has inclusive school toilets. India, Indian gender inclusive campaigns have been there. And in Odisha, like the earlier speakers have told, that Odisha is a disaster prone area, and disaster plans, they have many disaster plans and dignity kits. So the key takeaways can be ensure inclusive planning. We all know that, we have already said about it. Invest in accessible WASH. Whenever we are framing certain guidelines, WASH policies and all, so equitable facilities that they can save the lives and uphold the dignity of the people, and force policy integration, like bridging policies and practices so that the gaps are removed. And we need to adopt global best practices and capacity building of the first responders, how to handle disability, and even the persons with disabilities, they need to be taught about how to ask for what they need. They need to be taught about self-advocacy. So when we include menstrual health management in disaster relief reduction, vulnerability can be turned into resilience. And that's all from my side.
Thank you, Doctor, for the inclusive framework. You have powerfully reminded us that menstrual health is not one size fits all issue. It must account for diversity as well. Thank you. So moving forward, now we open the floor for broader questions and reflections. You can raise your hands or post your comment in the chat. Let's hear from people across states and sectors. We already have one question. Should I tell that, ma'am? Often information and resources are inaccessible to menstruators with visual, hearing, or intellectual disabilities. How can we ensure inclusive communication and accessible MHM materials during crisis?
Yeah, MHM materials, such materials are lacking. First of all, such materials, they lack. And we need to convert them into, like for visual impairment, specifically, audio recordings should be present, audio books, audio recordings, and even like in Braille, we can give the materials, or the screen reader friendly things. Like nowadays the mobile phones are also accessible and completely accessible. So such materials can be given to them.
Thank you, ma'am. We do have Sir Aniruddha. Sir, you can ask your question, sir.
Yeah, actually, we are talking about menstrual hygiene management, and this is the need of the hour, I believe. Menstrual hygiene management in the disaster situation, as well as what Madam has expressed that she herself is physically challenged, and she has explained it well, inclusivity and all these things. But my question is that we are using this for demographic students, demographic research, and all these things. So this means menarche, age at menarche and age at menopause. So this is a very common information to be collected by the researchers who are doing the demographic work, demography work. And another thing is that there are lots of myths. What whether this is menstruation means only bleeding, only for 4 days, 5 days, 3 days, whatever it is, uh, heavy bleeding, pain, and related problems, or it is a cycle like for 28 days, or say 30 days, or say 32 days, whatever it is, and why this difference. So all these things, I don't think people know. I recently conducted I don't call it a survey. I just discussed with people, and the women, they said that uh, they don't take any sour thing like nimbu, like amla, and all these things. So they don't take. They don't know what are the benefits of having iron-rich food like banana, like ram, like all these things. So uh, my point is that how to educate the common people, the grassroots people, those who are for that. Another state is required, because it is she has very well explained about the dignity and the rights based concepts. Uh, for the first time, I have heard something, some right based concept or some dignity issues are raised by some it's very note.
Your
However,
voice is
my
breaking.
point is that, yeah, I am traveling. Maybe that for that reason. So my point is that uh, this is not the absorbing agents. So we are talking about sanitary pad and anything related to, because you are talking about disposal and all these things. These are uh, uh, very much required. But at the same time, what is required is what is very much needed. That is uh, for the menstruating girls and women, they should know, and there should not be any disparity uh, before attending the menarcheal age. So all the boys and girls, they should know, and they all know, but it is being so some practices are there in the society to hide it. So my point is that uh, to just avoid those issues, so that it can be very clear. It is a biological process, accepting it, and not only the menstrual this thing, absorbing agents like pads or whatever it is we are talking about. So we need to talk about the holistically. So that's what actually I wanted to say. Maybe uh, may not be okay, maybe broken, sometimes maybe disturbing, because I am traveling. So
Yeah,
thank you very much for the
what
space.
I comprehend from your comment is that you mean there needs to be awareness.
Yeah, it is not only awareness, people are aware. Awareness has to be translated into action.
Yeah, but we have internet, we have mobile phones, everyone has. We keep on looking at it 24 hours. And so there is whole lot of material available on internet in different languages, even translations are there. So I don't think it can
Madam,
be a problem.
basically, I'm a student of anthropology, and some 35 years back, I studied this demographic thing, and I know that age at men are, I have collected information. But the thing is that neither my PhD guide was aware, nor I was told that what for, why this data will be used. So data are available. It is there is no dearth of information, but the thing is that proper utilization, properly, how many of the people those you are referring to, that you are they are using smartphone and all these things, so they know that without YouTube and without this Facebook and other things, so this mobile can be used in for their benefits.
That's why we need events like that. What Sphere India is doing.
Yeah.
Yeah. So we need to attend such sessions and get educated. Yeah. We need more of that.
Also to add, I would tell that that's where we as social workers come into play. Like we do remove all these stereotypes, stigmas, and taboos around those menstruation through programs like street plays, and we directly come in contact with the public, irrespective of the gender. We do awareness sessions where we create awareness of what is actually happening and how we should take forward and all. So yeah, that was one insightful session for all of us, I hope.
Yeah, thank you. And I am ready to cooperate at all levels, because I know that in the schools, still the dresses, the girls, they are wearing school uniforms. So the lower part of it is still white. So who are the people, those who are taking the decision that it should be white? And they are, they never consider that change, if it is there for reasons, for something, some reasons it happens, then this girl will never come to this school again. So the one reason of school dropout.
Yes, sir. Thank you. Thank you so much for your input. So due to lack of time, we are just closing this Q&A session, and the questions that is left will be it will be taken forward by the team. So yeah, as we close today's session, let's carry this one message forward. Menstrual health is an urgent public issue, not a private one, especially in disaster setting. Whether through grassroots action or policy awareness campaigns or relief kits, we all have a role to play in restoring dignity, equity, and health as well. Thank you for this opportunity. Now I hand over this to Ms. Kripa for the closing.
Thank you, Satya. Thank you for very nicely moderating, and thank you for also giving us a perspective of a social worker by end of the session. It was very valuable. And thank you, Aniruddha sir, for also coming in and giving your insights. Thanks to all the speakers and the participants who had participated in this very important session today. And the question in the chat box, we will try to address it. Since we don't have time for it right now, we'll try to address it later. And presentations will be shared with all participants in an email along with the feedback form. The feedback form, we also have it in the chat box right now. We request you to take a moment to give us your feedback. Along with feedback of today's session, there is also a provision where you can give us suggestive topics which you would want us to work on next. So thank you so much. The recorded session will also be shared in the YouTube channel, Sphere India, where you can access all the videos. So thank you so much.
Thank you, everyone.